Hello, everyone, and welcome back to Voices Speak Volumes. Joining me today is Dr. Bruce Naughton. He is the Medical Director over at Univera Healthcare. Dr. Naughton, firstly, how are you doing today? And secondly, can you tell us a little bit more about your background and what it is that you do?
So I'm doing fine, and I'm very pleased to be here. I really enjoy the opportunity to engage with other members of our community. So I'm really a general internist, which means I was trained in adult medicine. I came to Buffalo in 1994. Most of my work has been in the city of Buffalo. I did a lot of my work was to try to develop programs to help people stay out of the hospital and alternatives to hospital stay. So I'm pretty familiar with the city. I've been in most streets of the city. A good portion of my work was really working with chronic illness. So I did work with people who were younger, in their 20s, but most of the work I did was after age 55 and 60. So with really the aging aspects of disability. I'm very familiar with disability, certainly dealt with many people who are aging, who had Down syndrome. That was very, very common for us, other developmental delay issues. So most of my work is with people who had ongoing chronic issues and functional, what we call functional impairments, right? That made it difficult for them that they may have needed assistance to do their daily routines.
I understand that Univera has embarked on the COVID-19 Community Conversation Tour, which addresses need-to-know information regarding the coronavirus. Can you tell us a little bit more about the tour?
Right. Well, Broderick Kaysen is very committed to engaging our community, and he's starting out with talks on radio and podcasts, and it's been very well received and has been ongoing. I think our goal is really to try to be clear, transparent. We're not supposed to we don't have an agenda. I, as a physician, don't really have an agenda other than educating and communicating with my community colleagues, my neighbors. And we want that information to be made available easily, where we go axe to grind, and just to speak from the facts. I don't really want to be quoting to you from some official government statement. I want to talk with you about what I understand and what we've integrated. And I really have had years of dealing with pandemics. The most common pandemic I deal with every year is the flu. And I have lots of experience with that and how to keep people safe. And I've established programs that we've kept people safe and we've avoided major outbreaks, say in a nursing home population or in a community day center population. So we're just talking about the facts, and the basic facts are that what is said repeatedly is true. If we need a social distance, need to wear a mask properly, and my goal working with Mr. Kaysen has really been to provide direct, clear communication and try to answer as many questions as possible. Again, and it really comes down to the fundamentals. And there is a vaccine that's coming. Testing is a benefit in certain situations. And I think what's come out of this, one of the more poignant conversations I had is with a grandmother, who's living with her daughter and her multi-generational family, and the children are coming home from school, and their first impulse is to run in and see grandpa and hug grandpa. That's just not safe.
No.
And we just go ahead.
Yeah, unfortunately, no, it's not safe at all.
And that's the kind of thing we want to emphasize. And I'm not coming at this. I grew up in Oklahoma. I do not agree with, but I understand some of this macho stuff that I'm not afraid of the virus, and I'm going to face it head on. I do understand where that comes from. I'm also a physician and have studied, and I know better. So when I tell people that this is real, and you need to wear the mask, and you need to be separate, when you're interacting, when you come from the outside, we don't know exactly who you've been interacting with. You need to wear the mask, and you need to practice. And people over age 65, and especially if they have any kind of existing medical condition, we've talked about this, diabetes, hypertension, lung disease, that person is really at risk for having a bad outcome related to the COVID. And so as much as that person may love and want to be with their grandchildren, they should be maintaining that 6-foot social distance, and when they're in the same room, wearing a mask. I hope that we know that children can contract the virus, they tolerate it very well, but they still can transmit it, especially the teenagers and older adults, and we've seen this now. So I think those rules around safety within the home need to continue, and it's going to be very frustrating as we move forward into the holiday season. I personally am limiting who's going to be at the house. You know, we have had wonderful, right? I mean, we don't have a large family, but family celebration of Thanksgiving is one of our favorite holidays. So it's painful. It's painful for all of us. Actually, you've heard about all the events that have happened out there with families in areas where the virus is raging. And my one son actually lives in Chicago. Actually got the virus because his office wasn't following the rules. He got the virus early on, and he was actually very sick. We were pretty concerned about it. He didn't go to the hospital, but he's pretty sick. But he's not coming. His brother's not coming. I think that's going to be the three of us here at Thanksgiving. But I think if there's other members of the family, such as grandparents who follow the rules, and you get to a larger gathering, as long as you really feel it's safe, that's fine. I think the young people have to be very, very careful.
Yeah, because we don't, younger people, we don't sometimes even know that we have it, like you said, and then we go on and we spread it to, the older, more vulnerable population. You mentioned the flu. We touched on it briefly a little bit earlier, but with flu season approaching and, the holidays and all of the above, and the winter, what should we be taking any more precautions than what we're already doing? Should we be doing anything differently? What should we be doing?
Well, I know that by your question, you know the answer. Everyone. So we're hoping, based upon, that we follow what happens in Australia. So their winter season coincides with our summer season, right? So their season precedes ours. And so they get a sense of how the vaccine works based on what happens in Australia. Australia's very low flu season this year. So we're hoping that it's going to be similarly low for us because people are following all the rules related to COVID. That does not mean that someone shouldn't get the vaccine. Vaccine. So I have not had the flu since, well, I won't say exactly how old I was, but in many years, okay? My first year out, when I was finished training, I was not working in the hospital, I was working in an outpatient setting. A lot of people had the flu, and I got very sick. And so since then, we just weren't vaccinating as often back then. It wasn't as widespread. It was for a more high-risk population. We figured out to vaccinate everybody, and I have not had the flu in all those many years, and I've been exposed to many sick people. So the fundamental thing around the flu is that you get the vaccine. Beyond that, and we have barred people who don't have the vaccine from coming into certain contacts where we have control of what's going on. Beyond that, it's the same rules for the COVID. If you're sick, if you've got a head cold with a high fever, with a significant fever, that's very likely the flu, and you should stay in. Not every cold is the flu, but if you have a fever with it, especially if you have a lot of aches and feel like you've been hit by a truck, it's very likely the flu. And you should, the whole point of this is protecting your fellow man and woman, fellow person. If you're sick, stay home. And I think that ties in a little bit to the American culture, don't you think? Where I'm tough, I can handle this. It's not going to keep me down. I'm going to keep working. And one of the fundamental rules for me I've learned as I've matured as a physician is if you're sick, you're sick. It's okay to be sick. It's okay to take care of yourself. It's okay to acknowledge that we're all human. Now, that's probably an important thing to do, is understand our humanity and how we're connected. Oh, and acknowledge that in yourself allows you to connect with other people, because that means we're all connected in our vulnerability. And frailty and recognizing frailty, not as a frailty, but vulnerability in each of us is a way of being empathic, connecting as human beings. I think acknowledge that it's not being a wimp, it's not being a coward, it's just protecting others. And our activity, I think.
Absolutely. And I guess we should, maybe that segues into a conversation about mental hygiene, with the holiday season coming up, with a lot of people maybe not being able to travel to go see their family or having to limit their family gatherings. How would you recommend that people cope with that?
Yeah, that's a wonderful topic. I think loneliness is probably one of the most unrecognized conditions. We know as physicians that depression often goes unrecognized, and loneliness clearly can lead to unhealthy behaviors. It can also lead to depression, anxiety, and other situations. I think you must be aware that the outcomes of isolation and emotional stress are being expressed in our community. The drug overdoses are up, homicide is up, abuse is the domestic violence is up. I think that again, going back to social connection, we should all be aware that social connection is really fundamental to being a human being. I think that we do have, like we have the Zoom, we have quite a bit of technology in a way, and communicating. I think we have to do that in a way that's not burdensome. I was finding weekly Zoom calls with some of my family members a little excessive. But it was important to stay in touch.
Absolutely.
And building a network where we are actually communicating on a regular basis. I have a couple of buddies who come over and we have coffee on the porch, social distance, every other week, which is an activity of staying in touch. Recognizing that loneliness can have negative consequences and that it's okay and natural to be lonely. And so reaching out to other people is an important activity, and also recognizing that person that you think might be lonely who is not reaching out to you. It's okay to reach out to them in a very natural way and saying, hey, I just was checking in.
What services does Univera offer for people with special needs in terms of also referrals, case management, et cetera, et cetera?
Yeah, so case management, one, is a big focus. We do have a case management panel. People can call up and say, I've got these problems and I'd like assistance in negotiating the healthcare network. For example, if I'm seeing this doctor, but I really am not sure this is what I should be doing, what would be my alternatives? Case management is committed to doing that, and their job is to know all the services that are available in the community and also potential referral sources. There's the range of services that someone might need who has a disability, starting at birth and continuing through, are all available. So physical therapy, assessment by developmental specialists. We have developmental specialists that we can go pretty far out to some very unique situations if necessary. A lot of that work is done by our pediatricians. They're pediatricians who can help access those services. The therapy services, speech therapy, OT, PT, psychologists, psychiatrists are available. It's not just available on what you need today, maybe what you might need for an ongoing thing. So maintenance services are available. Recently, I was involved in a discussion. Now, I was just on the outside on a discussion where they felt the services that we provided to school were not adequate. They felt, and the teachers felt, the services were not adequate, and yet the evaluations that were done by the school were saying that they were adequate. Our pediatricians have dealt with that situation many times, and they said, no, we think that this person, based on information we're seeing, needs to be seen by another specialist, and we're going to make that referral. Now, when I say all that, this is obviously it's not simple that you can just call up and say, I want to do this. There are criteria that are met, but a provider can call up and say, I'm concerned about this person, or I'm concerned about their child, and speak directly with us. And so if you may not like an answer you get, or you may be confused, we are in a position that I have these conversations almost daily with physicians or other providers in the community to try to make sure the right services are being provided. I think we're committed to whatever a person needs from a medical perspective, from a healthcare maintenance perspective, that those services are provided.
Just to wrap things up, are there any other programs that are going on over at Univera that you might want to, promote or speak about?
Well, I think, case management is really the growing thing, but I also wanted to say, which we talked about, vaccines. Vaccines important, but there are also there are other vaccines that are, let me just talk about this. There are a number of vaccines that are recommended even for young adults who have disability. And certainly there's a huge, there's a well-established vaccine schedule for younger people, people under age 20. And what we've seen is some of the routine healthcare has been put on hold because people have not been taking advantage of their office visits with their physician, mainly because people are concerned about going out. We have seen some data that said people have delayed getting access to care. One of the biggest concerns has been delay in vaccines. So the flu vaccine is important, but also getting access to other vaccines. Now, telemedicine is a very good way of communicating with your primary physician. It doesn't have to be done via Zoom. You don't need special equipment. You can use a telephone. Those are important points, I think, that I like to make.
Absolutely. I'm glad that you mentioned that. But other than that, I think we're all set. Thank you so much, Dr. Naughton, for speaking with me. And thank you guys so much at home for watching. And I will see you guys next time.